So, what I'd like to do now, I'm so excited to have our first guest. Carolyn MacKinnon is a clinical pharmacist, and I know hematology, but I don't know how to pronounce the first word. Nephrology,
Nephrology.
nephrology. I knew I was going to mess that up. I should have asked you before. And she works with the IWK Health Center.
So, first off, you probably think pharmacist. Maybe you think community, like Lawtons or shoppers, and you're dispensing, meaning, you get the pills for someone and maybe you counsel them and help them out. But I am a clinical pharmacist, which in hospital, I think is a little more exciting. So, what I do here is I work with two different teams. I work with the nephrology and hematology teams. So, nephrology would be any patient with a kidney disorder. Hematology are patients with blood disorders. So, we have a floor up on sixth floor, and I help the team out. So, yeah, you might be a bit surprised that there are pharmacists in hospitals. I know some people don't even realize what we do. But there are a lot of different roles. So when I first started at the IWK, we did have different roles. We have distribution. So that would be what you do in community. That's you get a prescription, you see if it's appropriate for the patient. There are a lot of checks that pharmacists do behind the scenes to make sure it's appropriate. You dispense it, you fill it, and you bring it to the floor. And we do the pharmacy for all the patients that are admitted in hospital. So that's our focus, are all the patients and women that are here. So then we also have, like a chemo room. So a pharmacist might help with particular drugs like chemotherapy for cancer patients. We have a sterile room, so you might help out with specific medications that have to be made in really sterile environments. So those are rooms that you have gowns on, which I suppose with COVID isn't too crazy to think that you're masked up. So you might help out with that. And there's a lot of things that happen behind the scenes. So where I'm clinical, I get to be up on the floor and I have a focus, like I said, kidney and blood disorders. So if a patient comes to hospital, gets admitted for whichever disorder, if they're not well, I can help out. And what a pharmacist would do on the floor, typical day, is you get to meet the family. You get to find out if they take any medications at home. And then you help the whole team here at the hospital figure out what meds they need now. So, what I love about my job here is we use the term multidisciplinary, meaning a lot of different disciplines come together. So, yes, you have your doctors, you have your nurses. We also have dietitians, physiotherapists, even teachers here, social workers, the list goes on, and we work together as a team to take care of our patients. So for me, yes, I can help find out what meds they take at home, what meds they need now in hospital, what doses they need, if they have any allergies. Sometimes two drugs can interact with each other, so you have to tackle that. And then another challenge is when they're ready to go home to help that bridge that gap. How do they get the medication now that they're home? So we help with prescriptions, we help with drug coverage because not everyone can afford their medications. So some people have insurance and that kind of thing. So I guess that's my job in a nutshell. I can also describe how I got here, like a career path, if you like. Um, so there are 10 pharmacy schools in Canada. Two are French, uh, and two of them are in Atlantic Canada. So that would be the one in Newfoundland, Memorial, and the other one is Dalhousie College Pharmacy. And that is where I went. Um, right now, to apply to a pharmacy course or a program, English, biology, the whole list is there online. And once you complete those 2 years, you can apply to pharmacy school. It is an interview process. And once you get in, it is a 4-year program. So I had done a 4-year undergraduate degree in chemistry and French just to keep things interesting. And I didn't know I wanted to do pharmacy. I was lucky that I did have a lot of family members in it, But it wasn't till I met a friend in my second year of undergrad that really got me thinking about healthcare. And, you know, people think of doctor first, but I found that a little intimidating and a little too hands on. So she was a pharmacist, my friend, and got me talking about it. And I really thought that could be rewarding. So never regretted it since. So I got into Dalhousie Pharmacy. And after 4 years, there's a big national exam that everyone going through a pharmacy program has to do. So it's a two-part exam. One is written and the other is in person. We call it a practical exam. That's really when you're practicing, there's a pretend doctor in front of you or a pretend patient, and just to test your skills. And you have to pass that national exam to then apply for a license to be a pharmacist. And then I wasn't done with school yet, so I went on to do a pharmacy residency. So this is a program across Canada. There's about 100 spots. It's an extra year of studies at a hospital. So I knew I liked the hospital side of things. I think what appealed to me was working with the whole team. You know, you have the doctor right there, the nurse right there. And yes, you are seeing patients that are more ill at that time, but it's just so rewarding to help them through that hard time and then seeing them go home when they feel better. So, hospital was what I was leaning towards. I applied to a residency and I did that at the St. John Regional Hospital in New Brunswick. And after that, I applied for a job at the IWK and I've been here ever since.
Excellent.
Yeah.
That sounds really cool. Really cool. I've worked in hospitals in the years ago, so I know that there is a pharmacy on staff, and most people, if you don't work in there, you don't always know that that's happening. So it's kind of cool, a little bit different side, because you're right. We all think of pharmacists as being, at the pharmacy. We don't think of them as being in the hospital. So what would kind of be the pay scale for a job in pharmacy?
Great question. So I can only speak to hospital pharmacy. I know when you think of community, there's a lot of different levels because you can be a manager, an owner, and work your way up. And same in hospital here. When you start, you're kind of in the dispensary. And then, like I said, I worked my way up to a floor. So I would say typical is actually $45 an hour.
Wow, that's a lot of money.
Yeah.
It's a lot of schooling, though, to get
A lot
there.
of schooling to get there. And I would say that's more the higher level once you've worked your way up.
Yeah.
It might start at 35, 38.
Okay.
Yeah.
Excellent. Um, so what about work-life balance? Like, do you work a lot of shift work, those types of things?
Yeah, so it's different for everyone. In hospital, I like to think we're the lucky ones because typical is Monday to Friday, 8 to 4, which is a dream. However, every 4 months, we do have to do so many night shifts and so many weekend shifts. So a night shift is 1 to 9 p.m. and weekend shifts are 8 to 4. So you do have some shift work and some nights there to sprinkle in your schedule. And I'll also mention what's unique to the hospital is we have a pharmacist on call every single night. So our pharmacy closes at 9, but something might happen in the middle of the night that a patient needs access to a very special drug that they can't get their hands on the floor, or someone has a question about a certain drug dosing. So there's always a pharmacist that has a computer and a phone at home, and they're at the ready to be called any time of night. So we do have to do so many call shifts every quarter too.
All right. Doesn't sound like you do a lot of the call shifts and those types of things.
No, I'd say 1 in 3 weeks, like one
That's,
night every 3 weeks.
yeah. So that sounds like there's a lot of pharmacists at the IWK. Do you have an idea how many would be there?
Our whole pharmacy staff, including technicians, there's about 65. So I think there's 20 to 30 pharmacists.
Wow, that's a
Yeah.
lot of people in one, like, that's just one hospital.
Yep. Yeah, we're a big team.
It sounds like it. So what kind of courses should kids take or the students take in high school that would help them get into the programs they need to get into?
Yeah, so with a pharmacy program, there is that 2 year requirement to get all of the necessary courses in. I say 2 years. I took 4 years just because I wanted to finish a degree. So a lot of them are a bit science oriented. So I did lean towards biology, chemistry, and even physics and math and that kind of thing. So if you take it in high school, it does help out for your first year university. I do find that first year university is a huge transition. It's all on you now to do all the coursework. So if you've been exposed to it in high school, it's a little lighter on the head in your first year of your
Right.
undergrad. So yeah, probably the sciences.
Yeah. And I mean, I know the hospitals have been greatly affected by COVID, but how has your position been affected by COVID?
Well, when it first hit, it was a big change. We changed everyone's schedule, and for 3 months, we did 12-hour shifts. So we were here 8 to 8, and it was a rotation. It was 3 days on, 3 days off, 2 days on, 2 days off. But we had a lot less patients admitted because of we weren't admitting people just for checkups. We were really having to restrict that. We couldn't have learners, and something I love about pharmacy is we always have pharmacy students or residents around. Second year, fourth year students in pharmacy are required to do rotations, and the school will give you a placement. So we always have learners, which I absolutely love because I learn from them. They know all the new tips and tricks out there. So we didn't have any learners for a year. And what's unique about my nephrology position, so those are the kidney disorder patients, is we are the pediatric nephrology center for Atlantic Canada. So any child with a kidney disorder that needs to be seen by a specialist would come to the IWK. So we have a lot of patients from Newfoundland, New Brunswick, and some in PEI. So for them, it was challenging because they weren't flying in for their regularly scheduled yearly visits. So a lot of virtual things and doing things remotely. So I call Newfoundland a lot and touch base with my patients. Yeah, so that was a challenge.
That would be very different for
Yeah,
sure. I mean, I know that, as frontline workers, it really affected the healthcare system an awful lot. And
yeah.
hopefully we're past the worst of it now as we all get vaccinated and things like that. So hopefully that's mainly over. Do we have any questions from any of the teachers or students? I am watching the chat. If anybody'd like to put some questions in there, it would be great.
I'll put a little plug in.
Yep.
Another great thing about pharmacy is for your license every year, you are required to have 15 continuing education points. We call them CEs. So, what I love about this job is it's continuous learning. You can never get bored. There's always new drugs, always new therapies, always new studies. So, you're always learning these things, and you do have to complete so many a year. And I love that. And our role is evolving. So 3 years ago, we weren't injectors. So just like in community, you can get your flu shot. We helped out with the vaccine COVID clinic this year. So I was helping inject some of the first round of patients. So that's a huge thing. I know in community pharmacists can prescribe for certain things now if you can't get in to see your doctor.
Hmm.
So when I first got into pharmacy, none of that was in place. And fast forward 5, 6 years later, and here we are doing flu shot clinics, COVID clinics, prescribing. Yeah, so it's exciting.
Yeah, and I mean it's great. And a lot of jobs get a little bit stagnant, but you certainly would never become stagnant in your position.
Now every day it's something new.
Yeah, I can see. Yeah, that would definitely be true. Um, just kind of one last, and I probably have an idea what the answer is, but maybe you have a different answer. But what's the most challenging part of your job?
Maybe the unpredictability. We can never predict when we're going to have a very complex patient come in who is very unwell. And something we say around here is sometimes treating kids is a very gray area. There's not a lot of evidence for certain things that pop up. Sometimes it's more rare. We get complex patients. So you can never predict how your day is going to go. Kind of have to go with it and know your resources and work with your team. And from a pharmacy perspective, honestly, drug coverage is frustrating to deal with, but that's another. ballgame.
Yeah, and that's, if you don't have insurance, and even some of the costs, even some of the costs of many of the drugs, even if you do have insurance, can be huge.
You got
So,
that right.
yeah,
Yeah.
excellent. I don't see any more questions. I think you've covered everything so well that we don't seem to have any questions in there. We have a lot of people joining us now, so it must be a couple of our schools are just getting in. So we've got a couple more joining us, but of course we've recorded it, and the teachers will get links to all of the recordings. But thank you so much, Carolyn, for joining us today.
Oh, my
That was
pleasure.
super cool.